most important issue that Congress should focus on in 2014 is health care, especially on working towards compromise of the Affordable Care Act, or Obamacare, getting the act and its website up and running properly and functioning properly, and setting the wheels in motion for the future of American health care.
Since the passage of the Affordable Care Act in March 2010, a stark contrast has existed between the Democrats, who want the bill efficiently and effectively put into effect, and the Republicans who refuse to compromise on any issue without its repeal, even going so far as to briefly shut the government down over the law this year. Supporters of the law, Democrats usually, see it as helping millions of Americans who previously could not afford health insurance to have access to it by reducing the cost of health care for individuals and the government by increasing coverage and affordability. Those against the law, commonly Republicans, and small businesses, see the law as a tax and as something that forces businesses to cut hours and employees to meet the regulations.
Those in favor of Obamacare say that the act will allow affordable health care for tens of millions of Americans for whom health insurance is currently too expensive. Those who are already covered by their employees have caps on how much they have to pay out of pocket for health care, as well as free preventative care. Insurers also can't inflate prices if too many employees are sick. Medicaid is also expanded to cover more poor adults, many of whom are not covered today, but only if the state that the individual lives in agrees to the expansion. Special healthcare marketplaces are also being set up for those who aren't covered by their employer or may not be able to afford insurance on their own, promoting competition from private insurance companies to keep prices low. These marketplaces will have strict rules to ensure that they are fairly operated, and it is estimated that these marketplaces will allow for about half of the currently uninsured Americans to be able to afford insurance. Also, they cannot turn away people who are currently sick or have pre-existing medical conditions, so that is another major advantage. Finally, young adults will be able to stay on their parents' insurance up until age 26, allowing them to better start up their own financial situation. Supporters fervently hope that Obamacare will help stem the tide of rising healthcare costs.
Conservatives in Congress, meanwhile, have been extremely critical of Obama's signature domestic policy achievement, Obamacare. They say that it will force businesses to spend more on healthcare costs and hire part-time workers instead of full-time to avoid paying the extra costs. One big part of Obamacare that has been a particular area of scrutiny is the individual mandate. It causes those who do not have health insurance by January 31st, 2014 deadline to pay a fine for each month that they do not have insurance. Many see the tax as unfair, as those who still may not be able to afford the insurance will be taxed regardless of whether or not they can afford the insurance. Additionally, since insurance companies will now have to cover sick people, everyone's cost of insurance will rise due to the increased cost that the companies will have to pay. Ultimately, many of those who are not in support of Obamacare say that the act focuses more on the making sure everyone is a majority of Americans are covered than on actually making healthcare more affordable for people, companies, and Americans alike.
And now a word from our president.
Part of what I think the resistance that we've seen ramp up, particularly over the last couple of months, is all about is the opponents of healthcare reform know they're going to sign up. In fact, one of the major opponents, when asked, well, why is it that you'd potentially shut down the government at this point just to block Obamacare, he basically fessed up. He said, well, once consumers get hooked on having health insurance and subsidies, then they won't want to give it up.
Now a Republican representative's outlook on the issue.
And now it has become a Category 5 political hurricane that is not just causing havoc in certain regions of the country. It is ripping apart every region of the country, from tiny hamlets and towns to major cities, where people are finding confusion, chaos, cancellation, cost increases, all of which were predicted.
Hello, this is Nurse Kathy King, and we're going to ask her some questions about the current healthcare situation. Will the Affordable Health Care Act affect your job in any way?
Yes, it will. In fact, it already has affected quite a few nurses' positions. At IU Health, you may have heard recently that they cut 900 positions. Of those 900 positions, 600 were nurses. Your family member gets sick, you come to the hospital, they need nursing care, from everything from medications to vitals to assessments to recognizing that they're bleeding internally. You not only do not have a nurse now that does that, but you have a PSA, a patient care assistant, that will have about 4 weeks of training, and they will come in and assess your family member. So it will definitely affect your care. It affects our livelihood, our income, our families.
So what is your opinion on the Affordable Care Act and the whole current healthcare situation in general?
My opinion, why fix, it wasn't broken to begin with, so why fix it? Everyone had health care. They could, if they got sick, they could have went to a hospital, they could have gotten care.
We think short term, it looks like this law will be beneficial, since it allows many of those without insurance now to get affordable insurance that benefits both young people and older people alike. In the longer term, however, it may put a big debt burden on the government in the coming years, and down the road it could mean more taxes for all of us. Overall, compromise is what Congress should strive for this year in order to make this law as good as possible. Congress could get rid of the individual mandate, instead giving the people more time to sign up, or adding a small tax to wealthier Americans in order to appease Republicans and make them more likely to compromise. Or they could agree to increase taxes on the wealthy in order to help pay for the bill in exchange for fewer restrictions on business. The most important thing is that each side is willing to give and take rather than absolutely refusing to compromise with each other.